So our next question is from Steve. And Steve asks, how can the public choose which experts to trust when the WHO, the CDC, American Medical Association, Dr. Anthony Fauci, prominent modelers, state and local health departments, and CIDRAP, among others, may take positions that seem at odds with each other? If we as a nation can't even agree on which expert to listen to, what hope do we have of finding the right path out of the COVID-19 forest fire?
This is a tough question. I find myself in the middle of some of this, so I'm not sure how much I'm part of the solution, how much I'm part of the problem. Let me just say that this has been an extremely frustrating experience for those of us who have dealt with information to the public and over the course of decades. This pandemic has obviously consumed the news media in many cases, the majority of the day. It surely is front and center in discussions about lives. We've shut down businesses, we've closed schools, we've stopped sports. I mean, look at all the air transport, look at all the things. So it makes sense that it's front and center. But what's happened is we've had an explosion of experts. And, I have promised you on these podcasts, as well as anything we come up with CIDRAP, the most important thing we'll promise you is we'll just always tell you the truth. If we don't know, we'll tell you we don't know. If we do know, we'll tell you how we know and why. I at the risk of making you wonder if I know anything, as the staff will tell you here, the people who help put this podcast together, it's not unusual for me in a week preparing for a podcast to spend anywhere from 10 to 20 hours getting prepared. Going back in and doing deep research to understand what we know and what we don't know. I'm an epidemiologist. I'm not an aerobiologist. I'm not an industrial hygienist. I'm not a clinician. I'm not an immunologist. And what we have had happen is a lot of people who are coming from those disciplines have suddenly become an expert on the entire topic. And I've been extremely frustrated to see people who frankly don't know what in the hell they're talking about now the voice of expertise on 24/7 news or the soundbite in any number of major news stories. So if it's frustrating for us, and at CIDRAP, we deal with this a lot, we talk about it a lot, because we always make it our front and center position is basically, if we don't know, say it. If we do know, how do we know it and why? And so I can't imagine how it might be for you. I would like to maybe just give some examples tonight that might be helpful. First of all, Steve asked this question, and Steve and I actually had an opportunity to have some communication about this because he also raised a point about me that I thought was very important. I have commented over a series of podcasts about the New York experience, which I did tonight, and talked about how they got it right. But I didn't talk about that in the context of what they did at the very earliest days. I just assumed, in a sense, I had mentioned in a podcast some time ago, the challenges in New York. But if you just listen to the most recent podcast, you say, wait a minute, how can you say everything's okay? Remember last week's podcast, I addressed a question that came in from someone who was concerned about me saying New York was okay, when in fact they'd lost a loved one in the long-term care facility in New York. And so one of the things I will try to do a better job in these podcasts is make sure there's continuity. And what I mean by that is I don't want to bore you by repeating the same thing over and over again. So somebody who's been listening to all the podcasts say, I've already heard that. But at the same time, for the new listeners, I've got to give you context. And so I will make an effort to do that. But let me just say a couple of things now about where we're at. Number one is the media has an absolute need right now, from their perspective, to have experts on. And oftentimes, if you're a guest on a show, I'm doing a number of them this week, talk shows. And oftentimes you have no idea what the question is going to be beforehand. And so people will go on and they will get blindsided with a question that may not even be in their area of expertise, even though they're there. And they feel obligated to answer. I don't. First of all, I don't go on shows without knowing what they're going to talk about first. Second of all, if I can't or don't want to answer that question, I don't. I answer the question I want to answer. Now, this may mean I'll never get another talk show again when people hear me say that, but they already know it. Anybody who's ever interviewed me knows that. But we don't have that kind of experience among many of the so-called experts who are out there right now, who are making claims about things. Remember all the talking heads that said, oh boy, this is going to be a seasonal virus. It's going to go away in the summertime. And there were a lot of notable people who you know who they are. We sat there and said, I don't know why you'd say that. We don't have any evidence that that's the case. And of course, it didn't become a seasonal virus. I could go through a laundry list of different things like that. So at this point, I would say, be skeptical of everyone, even me. Be skeptical. Don't take things hook, line, and sinker. Now you're saying, but I want to know. I want that anchor, and I get that. And I'm not going to sit here and say that there are several reporters who I follow very closely. I think they're some of the very best in the business. And just kind of, if you follow CIDRAP News, you're going to kind of know who those people are too, because we tend to follow them as well as our own materials. So at this point, be skeptical of media, et cetera, and I will try to do a better job articulating some of my concerns, and I'll do it right here tonight for you. The other thing is the organizations. This has been a significant challenge for me. I come from public health. Public health is my foundation. It's kind of, you might say, the altar of my professional worship. And so I want more than anything for public health agencies to be at their very best. I've been frustrated with WHO, whether it was the slow declaration of the pandemic, whether it was the issue around aerosols and recognizing the transmission issues. I've been very disappointed in CDC. I have dear friends and colleagues in CDC who are doing an incredible job internally. But because of what's happened where CDC has been so minimized, where they've taken positions that are not based on science, that's been really hard. And so I think we have to be very careful how we interpret information coming from there. Now, there's a lot of good information that comes out, but it's hard for you to know, wait a minute, what does this mean? The school opening was a good example of what we were talking about. And so I think it is hard. Where I'm having the biggest problem with right now is the medical journals. I think the editorial oversight for what's happening right now with COVID is really, really a significant problem. Everyone wants to publish. This is the hot thing to be in. So journals are being flooded with papers that should never get published. I used to think, we were drinking out of a garden hose to develop our understanding of what's going on. Then it got to be a fire hose. Now I feel like we're drinking out of a fire hose of boiling water. And I see so many bad papers getting published right now, where it was obvious there wasn't any oversight or review that anybody knew about that topic. And so I think that, and I challenge the editors of these journals, and I recognize they have a problem. If everybody who's working on this is so busy, they don't have time to review, then I get it. I'm trying to do what I can in my limited way to not stop reviewing, even though, we're really busy, because if I'm going to talk about this, I better also be part of the solution. But I know many of my colleagues who are so busy, they don't review. So now these papers are coming out and they really are a challenge. So I think that this is an issue. And let me just give you one that I think is an example of the challenge we have and that you might get. Over the course of the last several days, there's been a paper that's received all kinds of attention. In fact, it was in all the news in the last couple of days. And this is a paper that came out from the journal General Internal Medicine, not a very common, well-known journal. And the title of it is Masks Do More Than Protect Others During COVID-19, Reducing the Inoculum of SARS-CoV-2 to Protect the Wearer. This was from Monica Ghandi and colleagues. And their whole thesis in this was basically the theory that if you're wearing a face cloth covering, you'll get less virus in, and you're more likely to have an asymptomatic infection. And so the ideal would be to get infected with this low level of these cloth face coverings, and then you would actually be protected. And last night on CNN, Dr. Ghandi actually said, and I quote, "What the mask does is really reduce the amount of virus that you get in if you do get infected. And by reducing that, you have the lower dose, you're able to manage it, and you're able to have a calm response. You have mild symptoms or no symptoms at all." There is simply no data to support that. This is dangerous. This kind of paper is dangerous. Now, there surely are data that would address the potential for lower dose, but we actually have data from animal challenge studies with this very virus that says no, the difference it makes in terms of who gets infected and has symptoms or not is all about the host in terms of the animal model studies. And I put this forward. I'm sure this will not be popular when Dr. Ghandi and your colleagues hear about this, that I've been really critical of this, but I don't know how did this ever get through review. I would never have accepted this paper, and I've shared it with several of my close colleagues who have said the same thing. They would never have accepted this paper. Now, I'm worried because the message to the public that came out of this is, oh, you know what? Maybe if I do get infected with my face cloth covering on, I'll just get a little sip of the virus. I'll get a mild asymptomatic infection. Now I'll be protected. That is so dangerous. That's dangerous. That's just not about right or wrong. It's dangerous. And so I worry about this kind of concept. And without more data than they have here, and it was all, if you look at it, it's a house of cards on this paper. I didn't hear one media source challenging it. I didn't hear one person in my discipline challenge it other than our group. And that's really a concern to me. This is the kind of stuff you're getting confronted with so often. And I don't know quite how to help you other than to say, we'll do the best we can to comment on it and what to say about it. So this is a challenge. So Steve, I wish I could give you a better sense of how do we help lead you. I don't want to sit here because it sounds so damn arrogant to say this. We'll keep trying to do the best we can to give you the context. If this were really true, this paper here, I'd be shouting it from the top of the ceiling, okay? Saying, this is really a new major finding. Let's go with it. But let me also go one more. You know, I've said this multiple times on this podcast, and by now I'm sure it's you're all tired of hearing it, but you know, all models are wrong, except occasionally some give us some useful information. Modeling is a black box statistical process that, you know, I've had enough graduate hour statistics to know a bit about them, and I still sometimes just marvel at what people do. And we have put far, far, far too much emphasis on models in the sense of trying to predict where things are going. And more importantly, the people who do the models basically have given much more certainty about what that model stands for or what it tells us than ever should be done. Because in most instances, the assumptions made in these models are just so arbitrary. And so, you know, I can get a model to sing, I can get it to yell, I can get it to fall asleep. You know, it's all by what conditions I put into it. And I think, you know, the one that, you know, again, a personal friend I know who runs this, but I think the challenge we have today with the IHME models, the Institute for Health Metrics and Evaluation, University of Washington, have really been a disservice. And they're always presented with such certainty around what the information is. And, you know, we've gone back and looked at their estimates, and they've been off routinely on the number of deaths. You know, if you look at originally during March up through May, they were predicting how many cases would occur by the 4th of August, which we've now come long past. You know, if you look at their deaths, this is the estimate that they came up with, 81,000 in March, 26, 81,000 on 5th of April, 68,000 on the 3rd of April, the 60,000 on the 17th of April, 134, 137, 125,000 respectively in May 4th, 10th, and 25th. Well, the actual number was 154,000. Now they kept changing this, okay? And they did provide confidence intervals, which for at least in the last two estimates, they overlapped at 154. But if you go back and look at the pieces where they were on TV, you look at their statements in the media, it was presented with this certainty. And this is what the White House was using, was this kind of precision, that there was no precision at all. If you look at what's happened since then, now they're looking at, if you look in June, for example, on June 11th, they basically put out an estimate for what it would be like on the 1st of October, and said on that day we'd have 169,890 cases. 169,890 cases. Well, as of today, we have over 167,000 cases already. Deaths, these are deaths, by the way, I should say, excuse me, they're deaths. And again, we're already there. Now they gave a confidence interval, which if you look at that, the confidence interval on June 11th was from 133,000 to 290,000. My God, you could drive 5 semis through that estimate. Is that really helping us? But when it's presented with the precision, it's going to be 169, and nobody in the media challenges it. No, I don't see anyone else in the government raising the questions, what does this really tell us? And this has happened over and over and over again. Now, more recently, they've been talking about what would happen if people did masking. And it says that if, and the most recent press release on August 6th said, and I quote, the US forecast totals 295,000 deaths by December. As of today, when thus far 158,000 have died. IHME is projecting approximately 137,000 more deaths. However, starting today, if 95% of the people in the US were to wear masks when leaving their homes, the total would be decreased by 228,271 deaths, a drop of 49%, and more than 66,000 lives would be saved. Boy, doesn't that sound great? There is no basis for that whatsoever. If you look at the assumptions they've made about mask wearing and protection, they don't hold up. Yet if I read that, that's with such precision, and that's what the public is getting. So I challenge the modelers to stop being so certain of themselves and detail all of the challenges, and don't say that just somehow they arbitrarily decided that a certain percentage of people would be protected with masks or not, without any data whatsoever to say that that were true. It's just not. And then in turn, basically using these estimates in, this is the kind of thing that's driving public policy about what's going to happen or not. And so I urge that we have a new look at models. The media has to be part of that. Journal publications have to be part of this. And I can tell you over time, models do us more harm than good, because once you start losing faith in them, you somehow come across with, well, they're just inflating the numbers, or they're somehow, doing this or that, or they're giving you confidence intervals that are so wide, you're sitting there saying, now, I don't know what this means. Tonight you're going to be worth a penny, or you may be worth $1 million, and somewhere in between. What does that tell you? So to answer the question, which I know I've gone on about, you understand the frustration I have. And I really understand your frustration. And I wish I had a better answer for you. All I can tell you is we will continue to try to be the best source we can. We will try to be as objective as we possibly can. I would urge all of you on the mask issue as an example. We have seen ongoing challenges with the masking, and the example that you just saw in the first example I gave you about the protection and so forth. My commentary that's on our CIDRAP website talks about what we know and don't know about masking and what we need to do to find out. And we will just stick with that and try to give you the best information we can. The bottom line message is everyone, the media, the journal editors, and the authors, and any group that's putting out information needs to take more responsibility than they have, and they're not. And we should, you should be able to demand that. And I hope you do.